I have my standard sentences. One is fascism is a public health crisis. This is collective pathology. And here are the examples, and use that as a lead. That's very intentional. Why is that such a provocative idea to people who should know better? Here's all the evidence. Here's what we know from the literature. Why the resistance and pushback?
Well, because when there is mental pathology, those who are affected by it would be the ones to revolt the most. And that goes along with a lack of insight and denial. So they would have adamant denial. And the rest of us who aren't affected by it will feel that denial and their need to suppress this kind of discourse. And so we suppress it either out of politeness or fear of their lashing out, or simply because we feel pressured. And we need to overcome that. Some of us may feel that, well, the Nazis used rhetoric of sickness and deformity. We should stay away from that. But actually, we should figure out what is the true defect and what is not, and not allow them lots of power, elevate them to important positions. They will have overwhelming drives to do so, but it's a disordered drive that should not be encouraged and actually does them harm. We have to actually contain these individuals and give them treatment, not give them power. But because especially mental health experts have been silenced very early on when that happened, it was a clear sign to me of how serious things were. In fact, with respect to the Trump contagion, as I've been calling it, the mental health contagion, we've shut down all mental health experts. So it's spreading unmitigated, and we know what the outcome will be. It's actually quite quantifiable and scientific, and mental health professionals were accurate every step of the way as to how severe this was and what the timeline would be and how dangerous it would be. We warned that the psychological dangers in Trump without intervention would translate into social, cultural, geopolitical, and civic dangers, and that's exactly what happened.